Well, we're at the crown insert appointment at the moment. So you're currently removing the temporary crowns. Any tips or just gentle?
Yes, absolutely. Always be gentle, because this is the time that you really don't want to use too much pressure and things breaking off.
And again, the patient is not anaesthetised at this stage.
No.
Are there any retraction cords or anything in place?
No, in this case, we will be, because we're luting a PFM restoration, so I'm going to choose a GIC-based restoration, which I do not need a gingival retraction for. And also say Mississippi for me.
Mississippi.
And 55.
55.
How does that sound to you? Sounds pretty good to me.
Yeah, good.
And at the moment you're getting her well, you're checking phonation, is that right?
Absolutely.
And again, some Vaseline to the external surface
Yes.
of the crowns. Do you ever get concerned about it interfering with bond strength?
Only if I use too much Vaseline and end up in the margin. So again, I've learned over the years to only use the thinnest film on my fingers.
Well, here we can see your assistant bleeding the cement syringe.
Yes.
Why do you go through that step?
It's probably a habit that I formed over the years of having clinical errors. So we don't only just bleed the cement, we also bleed light body impression materials, temporary crown and bridge impression materials, temporary crown and bridge material, or any cement. The reason is because if you don't bleed it occasionally, the initial bit of that material, potentially it's not balancedly mixed. And then when you introduce that into the area that really matters the most, whether it's an impression or the cement or your temporary crown and bridge, then you're going to have a clinical issue later on. So because of that, we actually bleed things in a number of steps, not actually just once. We actually first bleed the cartridges before we put on the tip to make sure that there's no air bubbles. Then once we connect the tip, we bleed a little bit out of the tip. And then sometimes my assistant do actually bleed a little bit on the back of her hand before she actually passed me through that material for me to inject into whatever that I'm trying to achieve.
Now, the cement you're using here, what is its chemistry?
This is a GIC, or resin modified GIC. Because this is a PFM crown, I am very confident in the ferrule effect of this particular preparation. It has good retention and resistance form. Therefore, I'm not going to require any resin bonding for this particular case. So luting using GIC will be more than sufficient.
And I see you're cementing the crowns or seating the crowns at the same time.
Yes.
Why is that?
I think these are anterior restorations, which I think it's only 2 units. I think I can control the excess cement quite easily. B, I just don't want to have any potential issues that what if I accidentally seated one that's in a non-ideal fashion, then the interdental contact is going to be either too tight or not tight enough. So I just prefer to seat both of them at the same time.
And I've seen you tack cure.
Yes, this material is a resin-modified GIC, so one benefit is that you don't have to just sit and wait for that whole minute for your conventional GIC to set to the rubbery phase. So we tack cure for approximately 2 to 3 seconds, and that is already in a rubbery phase, so it's just much quicker.
And again, your interdental brushes.
Yes, my favorite.
Will you be asking the patient to use these at home long term?
Well, I usually ask the patient, I ask them, do you like the floss? And some patients, they are very used to flossing. In those patients, I check their flossing technique, because not all patients actually use the floss correctly. So assuming if their flossing technique is good, I have no hesitation for them to use the floss daily, but there is a large proportion of patients who's just either doesn't like using the floss or finds it very difficult to use the floss accurately. In those patients, I think perhaps it's not that beneficial to actually using the floss. Instead, you might as well ask the patient to use something much easier and much more effective, and hence the interdental toothbrush, I think, works great.
Well, looking at the after photos, she seems like a very happy patient.
Yes.
We can see perhaps a slight colour discrepancy between the crowns and the surrounding teeth.
Yes.
What's happening there?
Well, because when we are trying in the restoration, then subsequently cementing it and adjusting, we are working in a very dried field. So of course, when teeth are dried out, they're dehydrated, and therefore the adjacent teeth are whiter than the shade of the crown. So I do prime the patient before I set them up and hand them over that final mirror, which is, in this case, it would be Susie, because we've been, over the last half an hour, that we're working in your mouth in a dry environment. I expect the rest of your teeth to look whiter than the crowns, or the crowns look more yellow compared to your teeth. Don't be too concerned. Give it 12 hours and everything will blend in nicely, just like what you saw a moment ago.